What tests are used to diagnose raw lung disease? Imagine trying to catch a hidden problem before it causes serious trouble. That's exactly what doctors aim to do when diagnosing lung disease related to rheumatoid arthritis. They use a combination of tests to get a full picture of lung health. First up are pulmonary function tests. These are simple breathing tests that measure how much air your lungs can hold and how well you can move air in and out. They include spirometry, which checks airflow, and body plethysmography, which measures lung volumes. A key part is the diffusing capacity of the lungs for carbon monoxide, or DLCO. This test shows how effectively oxygen passes from your lungs into your blood. It's especially useful because it can detect early lung fibrosis even before symptoms show up. Next, imaging plays a big role. High-resolution computed tomography scans of the chest are the gold standard for seeing detailed images of lung tissue. These scans can reveal patterns like usual interstitial pneumonia or nonspecific interstitial pneumonia, which are common in rheumatoid arthritis-associated lung disease. They are much more sensitive than regular chest X-rays and are recommended for both patients with symptoms and those at risk but without symptoms. Chest X-rays can be used initially to rule out other issues like infections, but they are less sensitive for early or mild lung changes. Blood tests are also important. They measure markers of inflammation, such as erythrocyte sedimentation rate and C-reactive protein, which tend to be higher when there is active rheumatoid arthritis and lung involvement. Testing for rheumatoid factor and anticyclic citrullinated peptide antibodies can support the diagnosis of rheumatoid arthritis and help identify those at higher risk for lung disease. Sometimes, doctors perform procedures like bronchoscopy with bronchoalveolar lavage. This involves sampling lung fluid to check for infections or other lung problems. While not routine for diagnosing rheumatoid lung disease, it can be helpful if infection is suspected or other diagnoses need to be ruled out. In rare cases, a lung biopsy might be necessary. This involves removing a small piece of lung tissue for detailed examination under a microscope. It's usually reserved for complex cases where other tests don't give a clear answer because it is invasive. Emerging tools like thoracic ultrasound and digital auscultation are being studied but are not yet standard parts of diagnosis. Overall, diagnosing rheumatoid arthritis-related lung disease relies heavily on pulmonary function testing, especially the diffusing capacity, along with high-resolution CORT scans. Blood tests and clinical assessment also contribute to the picture. Often, a team of specialists including rheumatologists, pulmonologists, and radiologists work together to interpret the results and decide on the best course of action. Early detection is key because lung complications can significantly affect health and quality of life. Regular follow-up with lung function tests and imaging helps monitor the condition and guide treatment. If you have rheumatoid arthritis, talking with your healthcare team about lung health and appropriate testing is the best way to stay ahead of potential issues.